virus.
The state says Ohio's COVID hospitalizations are 10 times higher than earlier this summer. 10 TV's Gabriela Garcia kicking off our team coverage this evening in studio with the state's message tonight. Gabby.
Andrew, the Ohio Department of Health says we're now in a pandemic of the unvaccinated. With this surge and spread, this is the main message from doctors.
We are seeing people of all ages getting sicker quicker and requiring hospital care.
ODH's Dr. Bruce Vanderhoff says no hospitals in the state have had to turn people away, but he and his colleagues are still concerned about getting to that place. He says 1 in 5 patients in the ICU is battling COVID-19. Just last Friday, that number was 1 in 6. Rural hospitals in Ohio have 1/4 of their patients hospitalized with COVID-19, and 1 in 3 in the ICU have the virus.
Hospitals don't admit people who aren't very seriously ill anymore. All of those people are very seriously ill, and some of them are going to die. Nearly all of them are unvaccinated.
From January to now, less than 2.5% of those hospitalized were fully vaccinated. Dr. Vanderhoff and his colleagues say it isn't just younger adults being affected.
Something of a silver lining about a year ago was that the kids were getting infected, but weren't getting particularly sick. That's starting to change now. It feels different now.
Dr. Wong says kids can get respiratory failure, multi-system organ failure, septic shock, and can end up on a ventilator just like adults can. And as Labor Day travel and parties come, so do the recommendations. Distancing when possible, masking up for all, especially indoors, and above all, getting vaccinated.
When I look at our average COVID patient in the hospital, at least, they're on oxygen, they're struggling to breathe. A lot of them have longer-term health issues. If I had to weigh those two things against each other, it's not really a contest about which risk I would rather take.
Now, with flu season around the corner, these doctors are encouraging getting vaccinated for COVID-19 and the flu. Having both viruses at the same time is rare, but these doctors say it's possible and not something they want to see as hospitalizations keep climbing.